I'm Peter Fuggle. I'm Clinical Director here at the Freud Centre, and I've worked with children and their families for about 30 odd years. These are health words. Inpatient means that you come to a hospital and you stay in a hospital overnight. So your treatment requires you to be in hospital and to stay in hospital in that way. An outpatient appointment simply means that you come to a hospital or a health centre and you go home after you've had your appointment. Usually the appointments are, as we've discussed, they could be for about an hour in such a setting. So outpatient means you go home, inpatient means you stay there overnight. Firstly, I think it's important to say that the vast majority of mental health therapy or treatment that's offered to young people is offered as an outpatient, i.e. for appointments that you would come to and then you go home again. It's much more rare for young people to be admitted to hospital. And there's a reason for that, which is that where young people need to be for their well-being is at home. And the hospitals are not obviously not ideal places compared to a young person being at home. So any decision about a young person needing to come to hospital for treatment is a big decision and won't be taken lightly. And it's usually taken by parents and carers, together with professionals, therapists and doctors, who will consult with and ask the young person what their views are about coming to hospital. Now, understandably, sometimes young people are quite nervous about coming to hospital and not always sure whether that's what they really want to do. So it can be the case that they are encouraged to go to hospital, even if they're not very sure whether it's going to be in their best interests. So it's not always entirely straightforward. It's not just about whether a child is asked, do you want to come to hospital or not want to come to hospital. It's a bit more complicated than that. It's often that parents and professionals think that this would be the best thing for a young person, and they will be asked for their thoughts about it as part of that process. This depends on the treatment that you're in hospital to have. Like for all sorts of physical illnesses, the length that you will stay in hospital depends on how ill you are and exactly what the treatment is that you need. But broadly, for child mental health services, there are often two types of what we call admissions, types of inpatient treatments. One is relatively brief, might be between 1 or 2 weeks, in which you're in hospital because you've been in a particularly unwell state, particularly distressed, you might be feeling very low mood, suicidal, and people might be really worried about how you're feeling about yourself. And you need to be in hospital to be safe, to be treated, and then to make a plan for you to go home so that you go home in a safe way. Those are sort of shorter admissions, and then there are longer treatment admissions that might be for a month or between 4 to 8 weeks, sometimes longer, in which you're in a hospital in order to receive a treatment for a particular mental health problem, and that's a different sort of admission altogether. When you're discharged, this is always done in a planned way. So usually at the point of discharge is when you'll be feeling better, that you've recovered from how you were feeling when you first came into hospital. And then there would be a plan for how you'll be supported when you go home. That usually means there's a meeting with your parent and carer and the team in the hospital who will meet together with you and think about how they're going to make sure that you're going to be okay when you go home, and to arrange follow-up appointments, usually with your local team, so that you'll have appointments, what we call outpatient appointments, as part of follow-up. Some of that might be to do, if you're on medication, to also check how the medication is going and whether you're benefiting from taking the medication. I think your views and the young person's views about the medication is really, really important, and it needs to be respected and listened to by your doctor. So that's the first thing. I mean, it's important that you share your worries or concerns or your thoughts about taking medication. But usually, medication will have been prescribed for you in a way that have been a lot of thought and care has been taken to make sure that the medication you're being given is likely to be beneficial to you. And so before making any decisions about whether you want to stop taking your medication, the best thing to do is to go back to your doctor and discuss it with them. That's really a key thing to do. Obviously, in the end, nobody can force you to take medication. It's your choice to take the medication. But often it's important to really have thought through whether this is going to be helpful to you or not.